Jane Doe is a 63-year-old Caucasian female who came in today for evaluation of a cough she's had for 1 month. She stated she was in her usual state of health until about a month ago when she developed an acute cough she gets throughout the year, more specifically to spring and summer. Cough occurs several times during the day, and over the last week it has been getting more annoying and interferes with taking care of her grandchildren. Does take Robitussin for alleviation. Nothing exacerbates the cough. The cough is loose but unable to cough up sputum. Associated symptoms include congestion, runny nose, itchy eyes, and rhinorrhea. Denies shortness of breath, wheezing, dyspnea on exertion or pain. No history of smoking, COPD, asthma, allergies, sinusitis, or bronchitis. Active medical problems include hypertension, hyperlipidemia, uncontrolled type 2 diabetes with complications of diabetic nephropathy, peripheral vascular disease, and chronic fatigue since December. No surgical history. Both parents died of a stroke in her 60s, and father had diabetes and hypertension. Medications include Hyzar, Lantus 80 units every morning, Novolog 70 units 3 times a day. She takes Lyrica 3 times a day, Simvastatin 40 milligrams once a day, and does take Benadryl as needed for nasal congestion. She is a retired school teacher. She lives at home with her husband. She is the primary caretaker for her 3 grandchildren and denies smoking and drinking. She's had no recent chest x-rays, stated all prior EKGs taken were abnormal. Spirometry taken today was negative for COPD and asthma. CBC, CMP, lipid panel, thyroid studies, ANA, SED rate, and CRP tape were taken prior on office visit and all within normal limits. Denies fever, chills, headaches, dizziness, or night sweats. Has had a 10-pound weight gain in the past 3 months. Patient was not trying to lose weight and has not changed eating habits. Has had fatigue for the last 6 months, stated she is tired all day long, takes numerous naps during the day, and wakes up several times during the night. Positive for yellow rhinorrhea, congestion, sneezing, and itchy eyes. No swollen lymph nodes, murmur, angina, or palpitations. She has complaints of bilateral leg swelling at the end of the day. No other respiratory symptoms except the cough. Denies acid reflux and denies depression or mood changes. On physical exam, her blood pressure 124/80, heart rate 84, temperature 97.5, and 95% on room air. Height is 60 inches, weight is 150 pounds, BMI 29.3. No sinus tenderness, no discharge from the nose, clear lung sound throughout, breathing regular and unlabored. Heart rate is regular with no murmurs, no JVGD, and no peripheral edema on office visit. All other systems unremarkable. In summary, for management and treatment, the patient presented with a problem of a cough, did rule out asthma, COPD, acid reflux, sinusitis, and pneumonia. Even though she did deny seasonal allergies, the patient most likely has allergic rhinitis, will undergo allergy testing tomorrow, will get a chest x-ray, recommend over-the-counter antihistamine after allergy testing tomorrow, can continue with Benadryl and Robitussin, also recommend nasal rinses. Patient also presented with chronic fatigue and complaints of bilateral leg edema. Workup for fatigue was negative for depression, thyroid disease, anemia, autoimmune disease, and infection. Most likely secondary to obstructive sleep apnea, but refuses to sleep study and would not wear the mask. Because of the fatigue, plus the edema, we'll get an EKG and echo since past EKGs have been abnormal. Patient with uncontrolled diabetes, but being managed by endocrinologist and will defer for him for management.